Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Carcinoid tumors. Introduction. Carcinoid tumors are rare, slow-growing cancers. They usually start in the lining of the digestive tract or in the lungs. Carcinoid tumors grow slowly and do not cause symptoms in the early stages. In later stages, carcinoid tumors sometimes cause carcinoid syndrome. The syndrome causes flushing of the face and upper chest, diarrhea, and trouble breathing. If the tumors have not spread to other parts of the body, surgery can cure the cancer. This program will help you better understand carcinoid tumors. It covers symptoms and causes of the tumors, as well as treatment options. Carcinoid tumors. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing in an uncontrolled way. This causes an abnormal growth called a tumor. If the tumor does not invade nearby tissues and body parts, it is called a benign tumor. A benign tumor is a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called a malignant tumor or cancer. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For instance, a lung tumor may grow through the outer layer of the lungs to nearby tissues over time. It can also travel to the brain or bones. Cancers in the body are given names depending on where the cancer started. For example, cancer that begins in the breast will always be called breast cancer, even if it spreads to other places. Cancers that come from glands are known as carcinomas. Carcinoid tumors are tumors that originate from specific types of glands linked to the nervous system. These tumors grow slowly. Carcinoids tend to cause specific symptoms, which are collectively called carcinoid syndrome. It is the result of hormones made and released by carcinoid tumors. Carcinoid tumors are often found in the gastrointestinal tract or lungs. If they are in the gastrointestinal tract, they usually grow in the appendix, small intestine, rectum. Risk factors. It is usually impossible to specify the cause of cancer in an individual patient, but we do know what causes cancer in general. Certain factors can increase a person's chance of getting cancer. These are known as risk factors. Age is a risk factor for carcinoid tumors. Adults who are 60 years or older are more likely to develop a carcinoid tumor than young people or children. Women are more likely than men to develop a carcinoid tumor. Having MEN1 or a family history of the disease also raises a person's risk. MEN1 stands for multiple endocrine neoplasia type 1. MEN1 causes multiple tumors to grow in the glands of the endocrine system. Having certain conditions that affect the stomach's ability to make stomach acid raises the risk of carcinoid tumors in the gastrointestinal tract. Some of these conditions include atrophic gastritis, pernicious anemia, Zollinger-Ellison syndrome. Not everybody who has risk factors for cancer gets it. Also, some people who have no risk factors for cancer can still get cancer. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Carcinoid tumors may not cause any symptoms at first. Symptoms often start after the cancer is grown. Carcinoid tumors can cause carcinoid syndrome because of the hormones they make. Symptoms of carcinoid syndrome include abdominal pain, diarrhea, fast heartbeat, feeling bloated, flushing of the face and upper chest, trouble breathing. Other symptoms depend on the location of the tumor. Carcinoid tumors in the gastrointestinal tract may cause a change in stool color, constipation or diarrhea, extreme tiredness, jaundice, which is a yellowing of the skin and whites of the eyes, nausea or vomiting, unintended weight loss. Carcinoid tumors in the lungs may cause chest pain, pink or purple marks on the skin that look like stretch marks, weight gain, wheezing or shortness of breath. Diagnosis. Your healthcare provider will ask about your personal and family medical history. A physical exam will be performed. Blood tests can help diagnose carcinoid tumors. A blood sample is checked to see if it contains a hormone produced by carcinoid tumors. Urine or tissue samples may also be tested. Imaging scans can also help diagnose carcinoid tumors. These scans may include CT scan, MRI, MIBG scan, PET scan, endoscopic ultrasound. Tests that use thin lighted scopes may be used to diagnose carcinoid tumors. These tests include upper endoscopy, colonoscopy, capsule endoscopy. During any of the scope tests, tissue samples may be taken. This is called a biopsy. The samples are then viewed under a microscope to check for cancer cells. A biopsy is the only sure way to know if cancer cells are present. Staging. If you have a carcinoid tumor, your healthcare provider will determine the stage of the cancer. Staging is an attempt to find out if the cancer is spread, and if so, to which parts of the body. Stages of a carcinoid tumor are usually described using the numbers 1 through 4. A lower number indicates an earlier stage. The stage of cancer is determined based on the size of the tumor, whether the cancer has spread to lymph nodes, whether the cancer has spread to other parts of the body, and if so, to where. Treatment and supportive care. The type of treatment for a carcinoid tumor depends on the size and location of the tumor, the stage of the disease, the overall health of the patient. Treatment for carcinoid tumors may include surgery, radiation therapy, chemotherapy, hormone therapy. Some combination of these treatments may be used. Surgery is the most common treatment for a carcinoid tumor. It often involves removing the cancer and some of the healthy tissue around it. If the cancer has spread, the lymph nodes and other surrounding tissues may need to be removed. Radiation therapy uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. The way the radiation therapy is given depends on the type and stage of the cancer being treated. Chemotherapy uses drugs to kill cancer cells. Chemotherapy may be given in the bloodstream through an IV or taken by mouth. It can also be placed in a specific area of the body. The type used depends on the type and stage of the cancer being treated. Hormone therapy is a treatment that stops extra hormones from being made by carcinoid tumors. Treatment may also stop tumor growth. Cancer and its treatment can lead to other health problems. It is important to have supportive care before, during, and after cancer treatment. Supportive care is treatment to control symptoms. The goal is to relieve the side effects of therapy and help you cope. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Carcinoid tumors are slow-growing cancers. They usually start in the lining of the digestive tract or lungs. Carcinoid tumors do not cause symptoms in the early stages. In later stages, carcinoid tumors can cause carcinoid syndrome. The syndrome causes flushing of the face and upper chest, diarrhea, and trouble breathing. Risk factors for carcinoid syndrome include being 60 years or older, having MEN1 or a family history of the disease, having certain conditions that affect the stomach's ability to make stomach acid. Carcinoid tumors are diagnosed and staged using blood tests, imaging tests, and scope tests. Treatment for carcinoid tumors may include surgery, radiation therapy, chemotherapy, hormone therapy. Some combination of these treatments may be used. Talk to your healthcare provider if you think you may have symptoms caused by carcinoid tumors. If found and treated early, this type of cancer can be cured. Thank you for using Explain.